Good morning. This does feel a little bit like large-scale speed dating. I just hope it leads to a long-lasting, fruitful relationship. I'm the first person on that list. My colleague, Dr. Ouyang, is here. I think he's doing the next presentation. And another colleague who couldn't join us, Dr. Bartlett. We all work at Aston University. I and Dr. Bartlett are clinical people. We try and help people see better. We try and do research that help people see better. Dr. Ouyang is a lab person. He'll tell you more about his work shortly, but we formed a little group that we hope to be able to take our ideas from the bench into the clinic through clinical trials, and then hopefully onto the consumer, into the market. And by consumer I mean healthcare specialists, their patients, and also the wider public. That's an image of the eye. It's a cross-section through the eye. This curvy bit at on this side is where the light goes in. This lens focuses the eye on the retina, and in particular on the macula. When you're looking at me, you're looking at my face probably, you're using your macula. When you're looking at me but you're aware of other things around you, you're using your peripheral retina. So your macula is very important for detailed vision. It's what you use to look at people's faces, computers, Google, your phones, when you read. It's what you use your macula. And that's an area of the eye that we're particularly interested in. Don't know how well you can see this, but when you go and have your eyes examined, part of that examination will involve someone getting very close to you, usually with a bright light, looking through your pupil and looking at your retina. And in particular, they're interested in your macula. That image there, just in here, that's the macula. I've ringed it. It's the central part of the retina. What happens there is when light is incident on that part of the eye, it makes a chemical reaction. That chemical reaction makes an electrical stimulation, which sends information to your brain, and then you see. It's a very, very important part of the eye. And this is what the eye care specialists will see when they look in. That's the optic nerve head there. That's where the information from the retina gets transferred through to the brain, and you see. This is a healthy retina. This is not a healthy retina. This person, this is a photograph. This person has got a condition called age-related macular degeneration. It's a condition that leads to blindness. It's responsible for most of the blindness in developed countries, in the USA, in Europe, UK, Australia, places like that. This is end-stage macular degeneration. There's not much that can be done for this person. This person would not be fit to drive. This person would not be able to see even the top letter on the optician's chart. It's a very common blindness-causing disease. The groups that we're really interested in are the people that have the early version of this condition, that have yet to progress to this stage. And the other group that we're interested in is the people who are at risk of this condition. Who's at risk? People who are getting older are at risk. I guess that means all of us. People who smoke are at risk. People who are out in the sunlight a lot are at risk. People who have pale irises are at risk. And people who have a family history of this condition are considered to be at risk. Those are the people. This is too late for us, really. We're interested in those other two groups. Oh, and also being female is also a greater risk. Even when you factor out the fact that women live longer than men, even when you control for that, women seem to develop more age-related macular degeneration than men. This slide is meant to show how the population is increasing in age. The average life expectancy is increasing every day. In fact, it'll be a bit longer at the end of the day compared to the beginning of this day. It'll be a few minutes longer. People are living longer. As healthcare improves, we live longer, but then we're prone to developing all sorts of things, but one of the things is age-related macular degeneration, for which there is very little treatment. Cataract we can treat, glaucoma we can treat. There's very, very little treatment for this condition. Prevention is far better than cure in this case because there is very little cure. Lutein is a hydrocarbon, and you probably can't see, but maybe if you've got, you can look at it later. It's a hydrocarbon which, when we consume it in our diet or through nutritional supplements, eventually makes its way through to the retina and protects the eye from the sunlight damage and also from oxidants that the seeing process produces. So lutein is very good to have deposited in the retina. We don't make it any other way. We don't take it in by mouth. We don't have any in our bodies. Red. Okay. So sorry, that was a quick 5 minutes. So just to say that we are looking at ways to improve the bioavailability to get lutein into the eye. Gosh, that was.
My colleague Frank talked about the lutein ability from the clinical views, and what I talk about it is computational pharmaceuticals apply molecular modeling in the formulation development. And as we know, the conditional, the formulation development, it is a multidisciplinary research, and they strongly rely on the personal experience of the scientist. And also we need try and error, and it needs very long time, and it is also high cost. And then we think about, can we use the molecular modeling to in the formulation development and help us solve this issue? And then we use the molecular modeling to study the formulation, the mechanism of the formulation at the molecular level, and then develop the new formulation. So the potential of computational pharmaceuticals, the first, you can simplify the formulation development use a computer, and also reduce the trial and error, and shorten the time of the formulation development, and also decrease the high cost of the formulation development. And the next, I will use 2 examples how it is computational pharmaceutical used in the formulation development. As we know, cyclodestrine, it is a cyclic oligonucleotide, and used for the solubilization of the pool soluble drugs. And this one can be used for the drug molecules of the nutrition molecules. And here, usually we think about the cyclodestrine can form the inclusion complex with the drug molecules or the nutrition molecules. And then we use ibuprofen. Ibuprofen, it is a very common drug for the relief for the fever relieving the drugs. And then we can see how it is. And this video can help us to see how these ibuprofen molecules interact with the cyclodestrine molecules, and then help us to know this molecular level of the interactions, and then develop the formulation. As we see, ibuprofen is kind of complex with the intercept this cyclodestrine cavity and forms a very good the complex. And when we started is another molecule, it is a lutein molecules, as this collaborate with my colleague Frank. This is lutein molecules, and we found it is interesting, it's not from the inclusion complex, but it is a non-inclusion complex. And then we need multiple the cyclodestrine forms complex and forms aggregate of this in the formulation. So we also test in the wet lab, and also the solubility test. This is a cyclodestrine concentration, Y coordinated is lutein solubility. You can see when we did at the high ratios, about the 4:1 or 6:1, this cyclodestrine can fully increase the solubility of lutein is greatly than in the low ratio of the complex. And this will to match the prediction of the molecular modeling results very well, and also give us the clue how it is from the complex. So what I here is looking for the collaboration with industry and academic to apply of the technique and in the formulation development. Okay, thanks very much.
Good, so my name is Karina Wentel. I'm a a researcher or a postdoctorate fellow at the University of Portsmouth, but I also work between University of Southampton, the clinical teams in Southampton, and I do all my research on the Isle of Wight where I live. So my director of research at the university decided I should come today, and she also said that I should mention on the slide that I am the best allergy dietitian in the world, but she just says that when she wants me to write grant proposals, which I'm not interested in. But anyway, so I am a chair of a number of international and national food allergy organizations. I was a member of the NICE guidelines, and we are heavily involved in consultation to all the different food producing companies, baby food producing companies, and I also advise the Department of Health, and I sit on the advisory committee of novel food on the Food Standards Agency. So when you send your novel foods for scrutiny, then I'll be one of them. But the reason I'm here today is really that, we are particularly interested in allergic babies because we do a lot of research into prevalence of food allergies, prevention, how to manage and how to diagnose best these kids. And we know that from our own data in the UK, about 6% of infants have food allergies. That's about 42,000 allergic babies a year. But 30% of parents will be avoiding foods from a baby's diet because they think the child has got an allergy. The problem, however, is that there is no allergen-free baby food available in the UK. It takes parents 33% longer to shop, and it increased their food bill up to 39%. And parents obviously quite refer to the baby food aisle if they've got allergic babies as the library aisle, because they stand there scrutinizing every food label. And it's got a huge impact on the quality of life. We also know from the latest data published last week that about 60% of infants eat commercial baby foods on a regular basis, almost every day. And so what we would like to develop from the University of Portsmouth is a nutritious, and I really want to say fresh baby food range that's taste and texture appropriate. I'm not here to slack off other food producers, but no child is supposed to eat anything that's mushed up and come out of a pouch. That may say the lumpy one, which is not lumpy at all. So really texture appropriate foods consisting of a range of single ingredients that are free from the major food allergens. We've already done a lot of work funded by the University of Portsmouth into packaging design, what mothers want from baby foods, how they want it to be marketed, what would they like in it, how do they want us to sell this allergy-friendly message, but don't scaremonger moms to think that, any child can die from eating anything with a food allergen in. But really what we now need is, we need help with developing a business plan, obviously investors. We really need to bring the product to market, but I need a lot more help with people that's happy to produce fresh baby food, because both Danone and a lot of the other companies I've been to are worried about fresh food. But allergic babies in particular, and all babies, need fresh food to nurture their gut bacteria, because we know that a healthy gut is really the bottom line of prevention and managing food allergic disorder. So we don't want babies to have this highly sterilized food, and mothers don't have time. 60% of moms of toddlers in the UK never cook. So, you can see why it's so important that we should make sure whatever we put in a jar, a bottle or a pouch is going to be good for the baby. And we also, finally, we then need help with marketing and sales. So I've had initial discussions with all the food giants without mentioning them. They're all very keen on the idea. I think it's a great concept, but obviously we need a lot more work until we'll have the final product on the shelf. So I've got the yellow, but I think I'm finished now. That's all I wanted to say. Thank you.
Hello, I'm Rachel Hoyle from Nucleotide Nutrition. We're a small, medium-sized business based in the UK at Daresbury Innovation Centre. We've been involved in the science of supplementary nucleotides for more or less 20 years now. We've been working both with animals and more recently with humans. So we're very keen to collaborate with others now in the food and drink sector, and particularly feel that we're able to assist with nutrient absorption We can address nutritional deficiencies, support the body's natural repair processes and biological processes, and also offer a unique yet safe approach to nutrition. Our own food studies, along with the collaborations with other scientists, have led us to conclude that there is now a lifestyle and diet-induced essentiality for nucleotides. Foods that are naturally high in nucleotides tend to be things like offal, so liver, or the things that we routinely do not eat in our diet any longer. Our formulas, nucleotide formulas, are based on all 5 pyrimidine and purine nucleotides, and are there to support the development of RNA and DNA in the proliferation of new cells. We have looked at a variety of different biological processes where we feel supplementary nucleotides can be important, and that includes the maintenance and repair processes of the gut lining. For instance, we've looked at the histology across different species of farm animals, from pigs through to salmon, and found that we can increase the surface area of the villi and reduce lesions. Also, we've found that we can help the proliferation of specific immune cells. We've looked at the research using athletes under high intensity stress, and have found that we can significantly support their immune status. Additionally, there are other health aspects that we have found an impact of supplementary nucleotides, and I'll go on and talk about those on the next slide. The main areas that we wish to collaborate on, we'd like to link our research and expertise to other relevant funded research programs. The main health issues that our research has concentrated on are those where we believe dietary deficiencies have the most impact. We also have to admit that some benefits we just stumbled on. Our human clinical research has been conducted mainly in the UK for digestive disorders. We've done an IBS trial at the University of East London, and that was with Professor Christine Dancy using IBS participants in a double-blind crossover placebo-controlled trial. For immune disorders, we've mainly used sportsmen under high-intensity stress, and have found that we increase, or rather we reduce the depression of the IgA status. So, moving on, we have a current research program at Liverpool John Moores University that we're collaborating with. It's a fully funded 3-year research project looking at sports recovery and performance. Another area which we did stumble on, which was from cholesterol. The trial with sportsmen we did at Bath University, they also measured cholesterol markers, and we found that we raised the HDL cholesterol in a significant manner. Lastly, anti-aging is an area where we feel that supplementary nucleotides could be particularly important. There has been some research done in Germany showing that supplementary nucleotides can help the repair of DNA. And in their case, they looked at it under oxidative stress.
Hello, good afternoon. And I'm from Leatherhead Food Research. A lot of you probably know us. I know a lot of people in the room here. And we provide a wide range of scientific and technical expertise to the food and beverage industry. So really I'm here today, I'm not going to start using long words like macula or nucleotide or anything like that. I'm going to keep it very simple, very top level, because that's what I'm good at. So really it's just a bit of an introduction to Leatherhead and who we are. We're a 100% independent organisation. We've been around for quite a long time, 94 years now, and we're a strictly confidential an organisation, and we have a very flexible approach to IP for those of you who are inventing at the moment. And that flexible approach is because we're an independent organisation, we're quite happy to transfer that IP directly over yourselves with no strings attached. At the end of the day, we're a contract organisation. We have a multidiscipline workforce at Leatherhead covering a wide range of food technology and scientific expertise, regulatory and market intelligence support. And for those of you who don't know, we are actually principally a membership organisation, and we have a membership base of around 1,500 companies worldwide. Very much the philosophy we work on is about partnering with organisations large and small throughout the whole of the innovation process. And these are our 5 main scientific platforms. As far as TSB funded projects go, Brian mentioned a project that he undertook recently with a large chewing gum manufacturer, and we were one of the partners on that project. And in the previous Nutrition for Life call, we were actually, as well as the one that we worked on with Brian, we were partners on another project as well. So we have got a track record and experience of partnering with organisations in this type of funding call and this type of project. There are difficulties, but there's nothing that can't be overcome. So just to give you an insight into the kind of things we can do here, we have a very strong food safety team. We do a lot of work in natural preservatives and biofilms in particular. Our nutrition team, we have the capability to do human intervention studies. We have in vivo and in vitro facilities at Leatherhead. So I was quite interested to hear Rachel's talk immediately previously about the type of work they're doing, and maybe when I parked next to her in the car park this morning, I might have realised that and waited for her rather than trotting off. We have centre and consumer facilities, so if you're introducing novel and functional ingredients into food, then obviously there's a taste perspective of those. We have trained panels, some of those are specifically screened for allergenicity, and they've got a very long and established experience in a wide range of food products, from ice cream to snack foods to drinks, and we've even done things by where we've needed to evaluate the taint of denim that's been smoke damaged, for example. So covering everything from, say, ice cream right through to denim. We have a very strong global regulatory function, so if you're looking at some of those aspects where we might need health claim substantiation and support, then we've got the regulatory team to be able to back up that evaluation. And then our food innovation team covers most of our product development aspects and our ingredient functionality and feasibility. And I think earlier on in the M&A presentation, there was a nice little microscopy photograph of the Sodalo, and correct me if I'm wrong, but I believe that's one of our photographs from our microscopy team at Leatherhead. So we have a very strong range of expertise, a very strong range of facilities, and we can support any of you out there who are looking for technical expertise and technical support in your project.
I'm the Enterprise Director at Colworth Park. My role is to facilitate companies coming together and stimulate innovation within the park itself. We're located equidistant from Birmingham, London, Cambridge and Oxford, so right in the middle, nice and central. We have stakeholders on site. Unilever are the major tenants on site. It's their home to beverages, food and drink, R&D development. We have a pilot plant and lots of facilities and equipment. We have the facilities for prototyping, etc. We also have the Institute for Food Research with labs and offices on site. We have Cranfield University on site and the University of Nottingham, as well as the University of Cambridge. So what we're seeking is partners. So we're seeking partners interested in open innovation in the food and drink sectors. So particularly the companies that are here today. So I'll go through the people that I've highlighted, and I'll be happy to chat with you later. So we're looking for 3 to 4 partner companies to undertake incubated new product development at Colworth Park in refreshment, nutrition, safety, behaviour, micro manufacturing, to align underneath the call for nutrition as well. The reason to do this is that we have the Extra Lab, which is flexible workspace, and it's basic equipment that can be accessed within the Extra Lab, so it's all related to food and drink. And there's more sophisticated equipment that can be rented. And the space is free of charge to get your projects, your proof of concepts up and running. So we're looking for new ventures, companies, commercially minded academics to come into the space for 6 to 12 months and develop your ideas and concepts. The stakeholders within this are the Institute of Food Research Extra's commercial arm and Co-op Park and a few multinationals that we can pull together to stake some equity within your new ventures or new companies in order to leverage funding from the TSB. So if you're interested in talking to me later on about that, I'll be happy to talk to some of the people that I've highlighted in the list that I'd be interested to have a chat to over the break. So Craig Thomas from CN Seeds, Amanda Lynn from Copperline, Bob Craddock from M&A, Sarah from M&A, Peter Bross from Britvic, Mark Broughton from ESB, Terry from Fitterex, Paul from Janssen, Dr. Jan Knight from Knight Scientific. So if you're from a company or from a spin-out, there's a few more that I'm not aware of. But in short, we've got a lab with office space that can be utilised effectively free of charge for your projects to reduce your cost base. We've got food-related equipment that can be accessed and used. We've got expertise from the partners that I highlighted previously that can provide expertise, mentoring, or in-depth knowledge in particular commercial or academic areas of research. The additional facilities are, we've got sensory assessment panels that could be accessed, prototyping for processing equipment, and that's pretty much it, really. So thanks very much for your time.
Good afternoon. School College is an academic partner, potentially. We are largely in the further education sector, but we do deliver higher education as well, including some postgraduate capability. And we're very much concerned with the primary producer here, so the initial producer of both animal and plant products, if you like, and have the capability of doing farm trials with a 312 hectare land availability, which currently is mainly down to dairy and sheep production. The two potential projects that I think fit in with the scope here, hope fit in with the scope here, we're doing a lot of work on sustainable agriculture currently with Lancaster University as a partner, largely looking at water use efficiency, but there is an interaction between water use efficiency and nutrient use efficiency. Much of the debate we got into last year was about the excessive amount of water and the loss of nutritional value in vegetables, for example, and people got themselves into an awful mess with that. I think we need a little bit more initial research into what is the actual consequence of reducing water or excessive amount of water, and what happens to our nutritional content of our vegetables as a consequence of that. And we've also undertaken a project which has fed a waste product, essentially, which is the husk material from cold pressed oilseed rape to sheep in an attempt to improve the carcass of the sheep. And there's evidence there, and there was only initial evidence that in fact we're reducing the saturated fatty acid content of the sheep in that context, and greater consequences of unsaturated fatty acids. I think that's what I would say.
Hi, good afternoon everybody. My name is Mark Broughton from ESB Developments. We're a niche food supplements business based in Nottingham. I'm going to take a few minutes just to talk about vitamin D3. Vitamin D3 is absolutely essential for health and well-being for everybody. You obtain vitamin D3 from your diet, but also from exposure to the sun. In terms of dietary sources, vitamin D ingredient, which goes into supplements, into pharmaceuticals and into fortified foods, typically comes from sheep, from the lanolin, which is from the wool fat from their fleece. And this is unacceptable to many in not only this country but also globally. because of the fact it's derived from animals. So social groups such as vegans and vegetarians, totally unacceptable to them. But at the SB Developments, we in 2011 developed a plant-derived raw material which we called VitaShine. This material is actually from a lichen, which is a symbiotic plant. It's algae and a fungi which live symbiotically, and this is still the only accredited raw material known as vitamin D3, which is approved by the Vegan Society and Vegetarian Society here in the UK. We've been selling the ingredients by distributors in the US, in India, in Australia for some 2 years now, which is fantastic for us, apart from it's bloody expensive. We derive this from lichen, which is harvested by hand, it's processed, it's extracted, it's concentrated, and the cost to us in terms of ingredient is massively high compared to standard lanolin-derived ingredient. It's important for us, therefore, to come up with a biotech solution to producing this raw material on larger scale. And in order to get into staple foods like margarines, which cannot use lanolin ingredients unless they're going to lose their vegetarian status. So we've come up on the bench scale with a solution which is essentially to ferment the lichen, which is a combination of algal and fungal cells to produce D3, express it in large concentrations, which allows us to not only produce large volumes for the food sector and the pharmaceutical sector, but also will allow us to drop the cost of goods to be comparable with that from lanolins. So over the coming months, we hope to find partners experts in fermentation and also potentially some other processes which will allow us to produce this vitamin D3, an essential ingredient on a large scale. Just to give some opportunity to the concept, Frost & Sullivan in 2011 estimated the vitamin D3 ingredient sector to be worth about $400 million US, growing between 4 and 10% a year. We know most of that's dominated by the lanolin ingredients, and we believe with the biotech solution we can actually take a large slice of that business.
So, my name is Heath Parkin, I represent SmartTrack Technology Group, one of the leading global RFID manufacturers. We have 3,500 employees and total sales in excess of 250 million euros. So, RFID, yesterday when I mentioned RFID, I seemed to draw quite a lot of blank response. So, if it's not too rude, I'd like to just a show of hands if you're working or you're familiar with the RFID technology, radio frequency identification. Okay, I think that's probably a bigger group than yesterday. What I'd like to do, for people who do understand the technology particularly well, bear with me because I just want to give it a slight glimpse as to what some of the attributes of it are. Okay. So to those people who aren't familiar with radio frequency identification technology, if you think of the common barcode, we all know that this is down to item level across pretty much all the products that are available in the marketplace today. It's a fantastic thing, it's easy and inexpensive to use, but it does have some limitations. RFID, like the barcode, can add a unique identity to any product, whether it's living, mechanical, or inanimate any product. The advantage of RFID is that you can create a system to manage the ID and it cannot be replicated. For example, you can write a code that relates to a specific process or a specific product resulting from a specific process that cannot be defeated. Therefore, we create the ability to give a great accuracy on provenance onto what you guys are doing. You're formulating new ideas, you're bringing about new products. Ultimately, there's going to be a commercial element there. That commercial element has extra value if you can also support and demonstrate the provenance behind what you are developing. So, just very quickly then, if you're involved with process control and you want to control it accurately and automatically without the requirement for line of sight with some of the optical referencing systems, possibly RFID is something that you are considering or will consider at some point in the future. My job here today is to make sure that you are aware of SmartTrack, the brand, and that perhaps you consider speaking to us There's many arms to our business, not just bio, which I represent, but industrial, access control, and many of you now, perhaps in your pocket, are using our technology without realising it, because Sokimat Automotive is the world's largest producer of RFID immobiliser components, but we don't supply the market directly, we supply through intermediate companies. Okay, I'll just look at the slides. So, SmartTrack, RFID manufacturing company, all use applications, industrial logistics, access, bio, medical. A global company with a local presence. We do have a subsidiary company in the UK specifically related to animal identification, which is Dalton ID, based in Henley-on-Thames. We are brand owners of Sokimat. The reason I mention Sokimat Automotive is because when I say to anybody, SmartTrack, it's a blank face. People who are moving and shaking with RFID will recognise the name Sokimat. Sokimat Automotive brand is a SmartTrack Group brand. So, company focus in relation to the people in the room today is animal. We're interested to find new ideas of new tag developments. You might have a unique environment that you need, where you need to apply, get an RFID into a particular environment which is hostile. We want to be involved in developing that package, creating the plastic enclosure and supporting this type of development. So, I'd be very happy to speak to any of you at any point during the day. You might have applications now live. You may be looking at it's possibly something that you use in the future. Really happy to discuss it with you. If you want access to the industrial arm, I'm an ideal conduit for that. So I can hook you up with all the right people inside the global business. So I think that's me done. Thank you.
Hello, I just welcome you to my presentation, which is going to be 10 minutes, as we said. I just started at the University of Bristol on the 3rd of April, so I'm very new to the University of Bristol. And one of the first things that drew me there was this alliance, which is the new Food Security Land Research Alliance. This is now in its second year going forward, but we're now looking for industry and academia to work with us. We're an alliance with the University of Exeter, University of Bristol, University of Bath, and a BBSRC Research Institute, Rothamsted. We're a grouping of world-class bioscientists, economists, social scientists, and we're looking for ideas where we can work together. We also want to put forward, particularly for this call, the farm platform, which is at Northwick, which is part of Rothamsted Research. And we're really looking for industry and academia that can work with us and utilise this facility. So any products which you want to test at a farm scale, then this is the place to do it. The farm platform consists of 4 different farmlets which are completely enclosed, and therefore we can collect all nutrient runoffs, etc., which come from these different farms. So any products in terms of nitrogen utilisation, the use of soils, efficient phosphorus cycling, but also other nutrients. I'm particularly interested in the use of or the development of new products for selenium, zinc, macronutrients, work on omega-3. We're particularly interested in fertility of animals. Obviously, I'm coming from the University of Bristol Vet School, so we're looking in animal health, animal welfare, any projects which you have an interest or use for animal health welfare facilities, then please contact me. We're particularly also interested, obviously, in grassland systems, carbon sequestration, animal products resulting into animal health. So if we're using an intermediate of the animal to supply higher bioavailability of products to man, then we're particularly interested in this. We've got a wealth of experience in developing novel products with omega-3, novel products of selenium to improve shelf life, and products which can improve human health through animal products. Also looking at water resource use efficiency. Systems modelling is something that we've got a high area of expertise in, and as I said and highlighted before, particularly products and projects relating to animal health, welfare and product quality.
Thanks very inviting me here today. I'd like to use my 5 minutes to talk to you about my PhD project, if that's possible. So my name is Katie Lane and I'm a final year PhD student at Manchester Metropolitan University. And my PhD has revolved around the creation, the design, creation and analysis of nanoemulsions of vegetarian omega-3 oils. So first of all, to give you a bit of background on nanoemulsions, I've created oil in water systems, and nanoemulsions are systems with extremely small droplet sizes of oil droplet sizes. To give you an idea, you're looking at 1 metre to the power of -9, so extremely small, smaller than a red blood cell. The reason that we've done this is that we thought it would increase bioavailability of nutrients, not just omega-3 but fat-soluble nutrients in the system. So lower doses could be used, but they would be more bioavailable in the system. And to test this out, I created a nanoemulsion system and put it into a functional food, and then devised a clinical trial to assess how bioavailable my nanoemulsion was. As you can see from there. Basically what I did was devised a randomised crossover design trial. I used a yogurt drinking product. One treatment was enriched with the nanoemulsion, and the second treatment was enriched with a bulk oil. So the oil was just added basically to the yogurt with flavourings and sweetness. And I recruited 11 participants from the university, and I gave them one treatment, a 3-week gap, and then the second treatment with no omega-3 consumed in between. The nano treatment and the bulk treatment, as you can see from the graph over there, and I took blood samples at baseline, and then after 2 hours, 4 hours, 6 hours, 24 hours and 48 hours. And as you can see from the dashed line, the nanoemulsion was quite significantly 180% more bioavailable in the blood of the 11 participants than just the plain bulk oil added to the yogurt, and it was also significantly different at 4 hours. So this nanoemulsion was going into the system, into the blood, a lot quicker and in a lot more quantity than just a bulk oil alternative. Looking back, I wish probably I would have taken a blood analysis a little earlier, but that's the results that we've got there. So basically what we're looking for now is to develop this nanoemulsion system further, either with omega-3 or with other fat-soluble nutrients. We've actually got a patented system that was sent through for application in 2012, so we're looking to further develop this. And we're looking for support from companies or partners that are interested in developing this with us, to look at improving the bioavailability of fat-soluble nutrients. We also have other alternative methods where we could use systems with water, oil and water, so we could look at water-soluble materials as well.
Good afternoon. Thank you very much. We welcome you to be my presentation. Today I'm going to talk about the commercialization of bioactivities, cereal or enzymes for functional food and nutrition supplements. I'm Lily. I'm from Manchester Metropolitan University. I also worked for Manchester Food Research Center to provide a consulting service for international and local food companies. My interest is for the develop the functional food and also the apply the nutraceuticals in the functional food. I have experience in the formulation and the process development, and also develop the technology to incorporate the functional ingredients and nutraceuticals in the food for adding health benefit. So our research group probably have the couple of projects that is running in the company in the university. Katie Lin already provided nanoemulsion for omega-3. I'm going to talk about bioactive cereal soluble fiber. I think everybody know dietary fiber has been shown have the many health benefits, but recently this has been recognized that this health benefit more closely related with the soluble fiber. So if you check our food label, this can label total fiber. But if you check the soluble fiber, I think for example, Kellogg's products, the soluble fiber normally lower than 1%. But as the scientific research development with more health benefit has been recognized that with the soluble fiber, I think based on the scientific research in 2011, the European Food Safety Authorities has approved with great sperm Arbin's Island for the health claim on the reduction of glycemic response for the health people and the people with diabetes. Arbin's Island actually is main components for dietary fiber for wheat, corn, rice, and other materials. We can attract Arbin's Island from these materials, but the challenge is too expensive. We can directly attract from wheat flour and other materials. So we developed the novel process to attract Arbin's Island from industry byproduct and to make Arbin's Island enrich the product, and then we can use this product incorporated into the food product for the health claim. And our research group always, test the other, bioactivities such as immune stimulating properties of Arbin's Island. Based on our research results, we demonstrate the Arbin's Island, the basic Arbin's Island, have the very low, activity for stimulating immune system. If through the modification, we modify the structure and then improve the bioactivity in this area. So this compare with the commercial products such as beta-glucan and then the BioBrand. That's why is already commercialized in the market. So today, based on our the novel technology for producing Arbin's Island from the industrial byproducts, we can make, we want to commercialize this technology for the Arbin's Island enrich the product and use this product in the functional food for reduction of postprandial glycemic response for the both health people and the people with diabetes. And also this Arbin's Island enriched product can further processed to be the immune stimulator for the human beings and for animals. So we are seeking for collaboration and to support the commercialization study. So we are welcome any discussion on the potential collaboration. We are happy to provide our recent results and then to discuss about any potential collaboration, and then we can, apply funding together. So thank you very much for your attention. I hope that's interesting to you.
Okay, thank you very much. Good afternoon, everyone. So my name is Sarah Katsura, and I'm a nutritional specialist at Camden BRI. And I work alongside our food technologists to develop healthy food products and beverage products as well. Also here today is my colleague Danny Bayliss, and he's a new technology specialist. So I'll talk about our range of expertise and facilities in food processing and product development. And later on, Danny and I will be happy to talk to anyone who's interested in any of those areas. So firstly, we have experience in reformulating products for health. So for example, we've investigated various approaches for salt reduction. So in many products, the reduction of salt levels by stealth has reached its limits. That means that any further removal of salt would result in the product being unpalatable for consumers. But the salt targets continue to increase, so we need to reduce the salt levels even further in products. So Camden BRI is assessing novel techniques such as pulse salt layers and salty aromas to further reduce the salt levels of products, while still retaining the taste of that product. We're also looking at the use of sugar and fat replacers. So with the aim of reducing energy content while still maintaining the organoleptic properties of the various products such as beverages, biscuits and cakes. We can also reformulate products to include functional ingredients such as fibres, micronutrients and omega-3. And in this area we're able to interpret the science behind the functionality of such ingredients and can advise on the levels that are likely to be needed in order to achieve the desired health benefits. Furthermore, our food technologists can consider any technical challenges that might be associated with using these functional ingredients and look at ways to optimise the taste and the shelf life of the product when putting these novel, unknown ingredients into the product. We can also apply all of these different skills to new product development projects, so creating a brand new product rather than reformulating, and have the capability and facilities to take a product all the way from concept up to pilot scale production. So in our pilot plant we can perform a variety of traditional food processing techniques. So this includes heat processing, so both pasteurisation and sterilisation can be carried out, and we can do this either in batch or continuous processing. We can also apply a variety of other processes such as mixing, homogenisation, fruit and vegetable processing and drinks carbonation. Using these facilities, a wide range of products can be produced, with some examples being beverages and baked goods, and various heat preserved products, so for example sauces or ready meals. We also have a sophisticated baking plant for carrying out breads, cakes, biscuits. So we also have packaging experience. We can pack on site in a variety of different formats, so cans, pouches, plastic and glass, so really anything that you want to pack in. And we can also modify the atmosphere of that packaging as well. We have the facility to perform shelf life testing under controlled conditions. For example, we can manipulate the light, temperature and humidity to match likely storage conditions of the product when it goes to market. And we can also challenge the product and packaging with extremes of these conditions. So if you were going to market in different countries where the temperature was different or something like that. We also have non-thermal technologies, and this is where my colleague Danny Bayliss is particularly experienced. And we can preserve and modify food functionality using techniques such as high pressure processing, power ultrasound and pulse light. So if you're looking for a vitamin or a micronutrient which is normally lost during heat processing, some of these techniques might be particularly useful. So we feel that along with relevant partners, but our expertise and facilities can be applied to a variety of different areas within the core. We're particularly interested in nutrient regulation and delivery, novel and healthier foods, and production and processing of food and nutrients. So we're looking to partner with perhaps food and ingredient manufacturers who have an interest in developing healthy foods, and academic partners who have experience in techniques such as ingredient extraction, characterization, and also those with clinical trial facilities for assessing the efficacy of newly developed products in human subjects or perhaps in vitro. Also of interest are discussions with equipment manufacturers who might have novel techniques for food processing and development, and particularly want to develop healthy products using technologies that perhaps haven't been used in a food environment before. So thank you very much, and Danny and I look forward to speaking to anyone later who's particularly interested in the areas I've talked about.
All right, thank you very much. Hopefully it'll be a lot less than 5 minutes, this one. So I'm the brewing research and development manager for our business in Europe, which is 13 breweries. It sounds grand, but it's only, I am the one person who does that. So there's only one of us that does research and development now for Europe in terms of this type of area. Molson Coors is a big brewing company. I think we're number 7 in the world. It keeps changing, and we want to be number 4. So we're trying to grow. So we're quite a big brewing company with bases all over the world. And what we're interested in is we've got a problem is we're interested in no or low alcohol beers, but as many people who've drunk a no or a low alcohol beer will testify, some of them, they're not as good as a full strength beer. There's many reasons why that is, but they're not as good. And we're interested in academic partners or people with diverse experiences who might be able to help us with a perspective that would help us to develop better no or low alcohol beers. And I guess that hopefully fits with the government strategy around reducing alcohol harm and taking units of alcohol out. There's all sorts of reasons why the government might be interested in helping us do this piece of work. So we can see several angles, and you may well see other angles, or know people who can see other angles that would want to be involved in this. But these are some of the thoughts we've got: is could the alcohol be replaced with some kind of, X, call it what you want, something? Could we replace the alcohol with something so that the beer performs in the same way or delivers in the same way? Could we produce the alcohol and then convert it to something that is then not absorbed in a way, or is converted to another product, but yet we keep the organoleptic properties similar? Or could we look at the way that alcohol goes through the body, and could it be bound to something? Could we change the way that it's absorbed? Could we change the way it's broken down in the body in some way that would create novel products that have not been produced before? And we feel that could be a really interesting, exciting area. And that's the main thing. I think just as a further thing is, I think this is the first time we've been involved in these types of meetings. And also I understand there's a meeting on sort of food waste and byproducts. That's another area. If anyone has any ideas around that area, we're very, very interested in as well. So perhaps in the future, or if you want to make a contact about ideas in that area, we're really, really interested in that area too. So thank you very much.
Knight Scientific, or KSL, is the world exclusive manufacturer of light-emitting protein phylasin, and we developed novel kits based on ABLE, which is also our technology, analysis by emitted light. And these kits and assays are sold all over the world for measuring free radicals, antioxidant activity, and oxidative stress. So that's what we've been concentrating on really since 1990. I've come to the meeting just really to bring those items, because phylasin and ABLE kit, it's an enabling technology covering lots and lots of applications, but I thought I'd focus just on those to do with diet, health and well-being, because I think they interact with all the products you're thinking of making. So for example, we have developed what we call the ABLE rack, relative antioxidant capacity method. This is to quantify antioxidant activity in such a way that it's sufficiently accurate. We never accept a CV greater than 3%, often round 0. That means you can use antioxidant activity as a marker for shelf life, and most products, most plants, natural ingredients will have antioxidant activity because that's natural to them. So you don't have to sell a product because of the antioxidants, but many people put antioxidants to stabilize. Also, nutraceuticals, we support people in formulations, helping them identify interactions between ingredients, trying to quantify things called synergy. So that's another thing. Active ingredients we monitor during manufacture, so we also have a portable instrument so you can do your own testing, so that you know what stage might be harming your products, because sometimes you have many steps and you could find out which it is. You might then want to put your actives in afterwards, or you might want to actually put antioxidants in to stabilize the product. Shelf life, equipment is another thing we're working to help people check. Things like grinding will generate sometimes free radicals. Sonication is a no-no in my lab. Be careful, it generates free radicals. So anything that generates free radicals will be using up your antioxidants. If you don't know it, you think everything's all right. And product claims. I do a lot of work with the cosmetics industry, and I say, for heaven's sakes, don't say it unless you've actually done some experiment to prove what you're saying. Then we have the ABLE right. This is what we've been doing for many years. We've actually got a test to measure the antioxidant basal activity of people, and it's also very reproducible. That everything we do, we have to be sure we can look at people, comparing it to themselves as well as to a population. I've just put together a histogram of just under 1,000 people, so we know the normal distribution of people. We also have one for horses with 560, and they're different. With that, you can actually use it for people who are selling supplements, nutraceuticals, to see whether they're actually changing, it's actually working. And we do know that people were very low, and we've seen this with our results, that they always correlate to bad diet. What's good is that when people have a good normal score, they come back and they say, I'm really proud, I'm doing the right thing. So again, knowing, being able to measure things. And we have, and we'll look, this is one thing we're looking for partners, because we've identified with a very small trial of 150 retrospective samples. I think we had 99 controls and 150 diabetes, but they were all kinds, type 1, type 2. We are seeing people with very low antioxidant scores having correlating to diabetes, and I believe that we may be able to pick up pre-type 2 diabetes. So that's one of the things I'm looking for collaborations for that project. We've got Able Sport is the one we're concentrating now. We have a test. This is on blood, just a finger prick of blood, measuring the activity of the white blood cells, and we can monitor athletes to see before they go to overtraining. This is the holy grail in sports science, pushing people but letting them recover. And I've heard people talk about sports nutrition for recovery. That's very important. We can measure to see whether that's the case. We've got the test. We work with the Olympics, the medical officers. They all know our work. And we are hoping to be working with the British Cycling and Sky team. We work with the Olympic sailors. So we have good credibility in that. But again, it could be useful for people with their products. We measure oxidative stress and inflammation. Work in medical. I'm not sure what you got. Okay, I'll finish then. And anyone wants any more information, I'm around. Thank you.
Yes, so I'm from the Brain Performance and Nutrition Research Centre at Northumberland University. I'm the Associate Director of the Research Centre, and I'm a reader in sport and exercise nutrition. So I just wanted to really highlight the work that we do in our research centre with the hope that it might kind of interest some of you. So the work that we do falls into two main categories. The first is around brain function, and the director of the research centre, Professor David Kennedy, who presented yesterday in Edinburgh, he oversees the work looking at the effects of nutrition, food, nutraceuticals, ingredients, supplements on cognitive function and brain performance. So we run a whole host of human intervention studies looking at the effects of all these different types of things on the brain. So traditionally the work that they did, so Dave and his colleagues are cognitive psychologists, traditionally the work was very much focused on cognitive performance. So they developed a battery of cognitive tests called Compass, which is a bespoke battery of tests which is particularly sensitive to nutritional interventions. More recently, Dave's work has really kind of more focused on the mechanisms behind improved cognitive function, so looking at brain performance, using methods such as near-infrared spectroscopy to look at the effects of nutritional interventions on brain blood flow as well as cognitive performance. The work that I oversee in the research centre is very much focused around physical performance, metabolism, and appetite regulation. So again, we run human intervention studies looking at the effects of, again, ingredients, nutraceuticals, foods, meals, on exercise metabolism. So we run studies looking at performance in athletes, but also in just kind of the normal everyday person who is exercising. So the effects of nutritional interventions on fat oxidation during exercise, and on things like appetite regulation after you've exercised. So does what you eat before you exercise affect what you do after that exercise? Does it affect your behaviour? One of the really important things that we do is try to bring these two areas together. Traditionally, a lot of research has kind of been carried out either in cognitive performance and nutrition and physical performance and nutrition. And if you think of any example of sporting performance, there's always going to be a cognitive element in that. So looking at how we can combine the measures that we do in these two research areas into research, so really looking at multidisciplinary approaches to the effects of nutrition on human performance. Just a nice example of that is some work that we're currently doing looking at females and female exercises, and how nutritional interventions, so things that they may eat, say at breakfast or as snacks around their exercise sessions, yes, so how it affects their metabolism, but also how does that influence their appetite and their mood and things like that. So they're all very interrelated, and I think it's very important that we start to kind of bring this together to look at a holistic approach to the effects of nutrition on performance. So just some example areas that we've been working in recently. From the cognitive and brain function side of things, Dave and his colleagues are very interested in polyphenols, especially resveratrol, and published one of the first human intervention studies looking at the acute effects of resveratrol on brain function and performance. Other polyphenols we're interested in, vitamins, multivitamins, omega-3 fatty acids is something that we've focused on recently, so we've done some intervention studies in both paediatric populations and in the elderly. In terms of performance and metabolism, one of my key interest areas at the moment is around milk and dairy products and how they affect recovery from exercise. And we've also looked at things like how do we change the glycemic response to foods and how does that affect metabolism, particularly fat oxidation in humans. So that's just a taster of the kind of things that we do. Basically interested in any kind of nutritional intervention that will influence human physical or brain performance. Thank you.
I'm sure some of you have travelled quite far here today, and on your way home you may be tempted by a takeaway meal, as it might be quite difficult to get home and cook. I thought you'd better be informed before you make that decision. I'm not going to say don't eat one, but to be informed. We've done quite a lot of research at John Moores on takeaway food in analysing the nutritional content. And some of this may surprise you, may not, but we've seen anywhere up to 3,000 kcal in one meal, 27 grams of salt in one meal, 90 grams of saturated fatty acids, 160 grams of sugar, 10 grams of trans fatty acids. However, the meals are really, really variable. Some are very high, some are very low. We've sampled across the board in takeaway. When I say takeaway meals, I mean from independent outlets. Your chip shops, your Chinese, your Indians, pizzas and kebabs, not the chains. So we've done quite a lot of work on the analysis of that, and working with the councils, Liverpool Council, and doing some small reformulations on takeaway food, just reducing the salt, reducing the fat. Done some sensory work on that as well, and we've got a current survey going at the moment. And what we really want to do is spread, Liverpool's done a lot of work on this, we'd like to spread this across the Northwest. I have some partners from the universities in the Northwest, and some of these are some of my ideas about studies here, and I guess the most important one would be, for today, would be more about reformulating takeaway foods. As I said, we've done some small reformulations, just reducing the fat, the salt, the sugar, and we've tested those meals in sensory. What I'd like to do is to do more sophisticated reformulations, looking at the types of fat. Certain takeaway food is deep fried, certain takeaway food is shallow fried, and there's no real consensus at the moment on what the best oil is for you for this kind of food. So I'd be looking for industrial partners to maybe come up with some oil blends that's ideal for takeaway food, to have a healthful, beneficial effect on cardiometabolic risk. Cardiometabolic risk is my area, and some of the proposals I've got is to look at the sort of acute studies, doing postprandial studies, looking at things like triglycerides, and even deeper into the sort of what kind of fatty acids and degradation products are taken up in the bloodstream from these takeaway foods, and to improve that from reformulating takeaway food. So I'm open to any ideas on any of those ingredients that I mentioned before. And also, we haven't done any analysis of micronutrients yet, so there's a whole host of smaller, obviously, nutrients there to have a look at and to see how we can improve takeaway food. And just to add that takeaway food has become, or out of home eating, has become a lot more popular over the last 10 or 20 years. And the latest figures are anywhere up to 20% of the population are eating this 2, maybe 3 times a week, depending on areas as well, depending where people live. So it's a huge problem at the moment. Currently I've got partners across the Northwest, academic partners, but no industrial partners as yet. So looking for really functional foods, oil blends, ways of reducing the salt, ways of reducing the sugars, ways of reducing trans fatty acids. And I think that's me done within the 5 minutes.
Okay, good afternoon everybody. So I'm Gareth Wallace, lecturer in sports nutrition at the University of Birmingham. And I should say I've been there for about 1.5 years, but prior to coming to Birmingham, worked for GlaxoSmithKline for about 4 years as a principal scientist in R&D in nutrition. So I have a fairly good experience of how these academic industry collaborations can work. So my main interests in Birmingham are in the area of nutrition and metabolism, and how nutrition and also physical activity can influence metabolism in the context of both sports performance, but also in the maintenance of health or in the treatment of metabolic disease. Just to give you an example, I mean, my 2 sort of main areas are around modulating carbohydrate delivery and also promoting fat oxidation. In the area of carbohydrate delivery, it really comes down to understanding how we can regulate gastrointestinal processes, and much of my work to date has been in how we can use our knowledge of the GI tract to accelerate carbohydrate absorption during exercise to improve fuel delivery for athletes, and this has led to being incorporated into many commercial products. But equally, understanding the GI tract and modulating carbohydrate delivery can have an impact in this guy, and I'll talk about that in the next slide. So I think it's fair to say my kind of core expertise is in using metabolic techniques, indirect calorimetry, stable isotope tracers, tissue sampling and analysis in humans to assess macronutrient delivery and utilization. I think this is quite relevant for the TSB scope around nutrient regulation and delivery and the development of novel and healthier foods, and particularly for anybody who's interested in understanding efficacy or mechanisms in order to support nutrition and health claims. So that's an overall view. I've got something very specific as well to share with you. Now, we all know that consumers like beverages and soft foods because they're very palatable. One of the problems with this is that they transit through the GI tract very rapidly and increase blood concentrations of glucose and lipids and have limited satiating power. So that can lead to metabolic disease states. What we've been doing recently in Birmingham in collaboration with my chemical engineering department is looking at ways to try and modulate the delivery of nutrients. And we've been looking at an ingredient called gel gum, which is an approved food additive, usually just used as an additive, not as a functional ingredient. But what we found in vitro is that when you ingest a beverage containing, when you formulate a beverage containing gel gum, and then you add acidity to it, it actually forms a gel. And so we kind of hypothesized that in the acidic environment of the stomach, you could actually ingest a beverage, transform it to a gel, and that may help to control satiety and also bind nutrients and delay energy release. So what we did was conducted a proof of concept human trial where we essentially created an energy beverage, so a glucose beverage with and without gel gum. And the data is here. This is in 8 individuals. What you could see, if you drink a normal energy drink, you get a very big spike in blood glucose levels, and then you get the crash. Okay, so that's a classic. What we've been able to show, incorporating gel gum, which is a very low viscosity compound, so the beverage is palatable. You have a minimized increase in blood glucose and also a much more stable profile of glucose over time. We also see some effects on satiety as well. So we think that this has a potential as an ingredient that could be considered as a functional food. So I think just to sort of summarize, we very much see gel gum as a food additive that could have functional food qualities, and therefore is potentially a viable technology for enhancing the control of satiety and nutrient release from beverages and soft food formulations. We're very much interested in discussing with any partners or parties that are interested in helping us develop this work. And myself and also my colleague, engineer colleague Jennifer Norton is at the back of the room and will be around for the rest of the day if anybody wants to discuss this with us.
So what am I going to talk about today? I'm going to talk about some of the research that's going on in my laboratory and how we want to develop novel foods for enhancing colonic health and general well-being. So, okay. As I said, there's lots of published evidence, including our own evidence, which I'll allude to in a sec, which says that an excess of iron in your diet drives colorectal tumorigenesis. And I should say also other cancers as well, but it's particularly bowel cancer. We only ever absorb a very small amount of the iron in our standard diet. The vast majority goes through the small intestine and ends up in the large bowel where it sits there for hours to days. And we know that iron is very toxic. It mediates ROS, and we've heard about antioxidants, for example. It mediates reactive oxygen species that could create DNA damage, lipid damage, etc. So it's bad for you in excess. I'm about to dash off actually a bit later on because I'm at a cancer away day where I'm going to tell people about red and processed meat. We all know that an excess of red and processed meat is associated with bowel cancer, a major risk factor. What do we know from animal models? Well, if you take animals that are predisposed to developing cancer or have certain genetic aberrations and you give them diets rich in iron, they get lots of inflammation and they get even more cancer. And if you take iron out of the diet, the mice, rats, never develop cancer or inflammatory conditions to start with. That's phenomenal. And there's lots of in vitro studies which say that if you put iron on cells, obviously you create damage, you can make them more hyperproliferative. So lots of iron is very bad. And this is an article we published in Cell Reports not that long ago, which basically says that this residual unabsorbed iron which sits in your large bowel in the background of a genetic aberration, which is very common in the elderly, drives cancer formation. So with that in mind, you would think that actually what you really need as a technology is to chelate, bind this residual unabsorbed iron in the large bowel to prevent cancer. But it's not just cancer. We believe that binding this residual iron is going to enhance health of the GI tract in general. And it's not just our data, there's lots of other data out there. This was a paper published in PNAS saying that iron chelators, molecules that bind iron, have anti-tumour activity, and they can also be used to enhance chemotherapeutic response. Okay, so that's just that's the background. So what do I want to do? Well, I want to develop novel foods which can be used to deliver iron chelating molecules to the colon, specifically to the large bowel. I want to bypass the small intestine because I don't want to make people iron deficient and anemic. So I want to deliver my molecule to the large bowel and large bowel alone. So I want a delivery system. So if there's anyone in the audience who knows anything about encapsulation to different parts of the gut, I'll be really interested in speaking to you. We currently have various molecules, iron chelators, that we're looking at. And some of the molecules we're looking at are hydrocolloid based, things like sodium alginate, chitosan. And these molecules have iron chelating properties, so we're thinking about delivering these molecules to the large bowel. But we're also generating novel molecules, so we're artificially manipulating some hydrocolloids and also other small molecules as well. And I'd like to take those to the marketplace as well. When you look at the literature as well, it appears that many of these iron chelators, these hydrocolloids for example, have a prebiotic potential as well. So if you give, for example, sodium alginate to man, you can actually enhance the levels of things like lactobacillus and bifidobacter. And I'll be very interested in doing some clinical trials where we use our iron chelators alongside, for example, probiotics and ask, can our iron chelators enhance probiotic efficacy? So I'm really looking for industrial expertise in encapsulation and delivery of our molecules to the large bowel to enhance health and to ultimately deliver a product that we can take to market. Thank you very much.
I'm from a small development company in Melton Mowbray in Leicestershire. So Melton Mowbray is very famous for its food heritage, and we like to think at Omnisutica that going forward we're going to be the food heritage of the 21st century. So one of the things that we've been doing we've been developing our own fee-for-service work, so we do pilot scale development, both liquids and for solids and semi-solids in our facility in Melton. And we also spun out originally from an IP company. So our parent company is Savantium, and they offer and started work in IP. Our CEO is a very innovative individual, likes to experiment, formed Omnisutica in order to ensure that we could conduct experiments that would generate IP for the company to be able to commercialise later on. And so we have a unique combination of IP and some development in order to be able to help companies identify potential pathways to either protect or exploit their ideas, products or process. I myself have regulatory knowledge in both pharmaceutical and in foods. I've recently worked with Boots Pharmaceuticals within their food supplements area, and we've been and have used the TSB grant system in order to be able to progress a couple of projects with the aim of getting 13.5 health claim applications. So within Omnisutica we can offer regulatory IP and technical services, but what we also do is that while we have, whilst we do that and we offer our fee-for-service work, we've also been looking to develop our own products as well. So we've developed a sports nutrition drink, and we've also developed here an apple snack-based product. So what we have is that we used some INET funding. It allowed us to take some blue sky thinking that we had. We've developed it into a gram scale concept. We've resulted in a very crunchy snack that's high in fibre, high in nutritional content. We've been allowed, through the technology and the processing that we've used, we're able to take waste products, we're able to take waste pommes from either apple apple juice manufacturers or the cider industry. We're able to take that and convert all of that waste, so the seeds, the pulp and the fibre and skin, and being able to make that into a crunchy snack. We see that as a very sustainable process. Obviously it fits in with a lot of the wrap type ideals, and we can see that it is an opportunity to be able to bolt on to an existing juice manufacturer. What we'd like to do is to be able to develop that process further. This is stuff that we develop off our own back with our own dollar. We're looking for further collaboration to either work with other fruits and vegetables. So we've done something with apples. We see that there are other opportunities with either carrots or beetroot, other products that have got high interesting nutritional content that consumers appeal. So we're looking to be able to scale that up. So we're looking to be able to take what we've got from concept to feasibility, and then from feasibility further on. We are looking for funding and partners, and some of the skill set that we're also interested in is looking around clinical trials and being able to generate the appropriate data in order to be able to take it further. And that's me. Thank you very much.
Give you a flavour of the psychology department, nutrition and health research group at the University of Reading today, and apologies for my cold. So, all of us in the group, our background, to put it in a nutshell, is measuring reliably and validly things about human beings, their performance, their intellectual and cognitive function, attitudes, and that includes measuring change of attitudes, behaviour, change of behaviour, emotion, mood, mental health. And myself, my specialism is actually in vision scientist, measuring vision and eyesight. We've got access to volunteer panels that go right across the lifespan. If you're interested in work with infants, we can recruit infants and their parents, toddlers, children, teenagers, of course the students at the university, and we've got older adult research panel, volunteer panel as well. Sometimes when you're doing research on nutrients, you don't just need to measure things about the people, you also need to measure things about the foods that you're using. So we've got, through our collaboration with the Nutritional Sciences Department at Reading, we can get access to high-performance liquid chromatography, etc. Also blood tests, urine tests, things like that. You know, most of the researchers in our group have got some experience of collaborating with industry and also research council funding. You know, most of the work we've done is human randomised controlled trial stuff, looking at the effects of individual nutrients. There's also some animal models. I'll give some examples on the next slide. Sarita asked us to think about, when preparing these presentations, you know, what expertise might complement ours, what we'd be looking for. But I suppose, you know, our experience so far is that when, you know, as we sometimes do, we find that some aspects of behaviour changes as a result of an intervention. As scientists, we want to test hypotheses about why it changed, and that always comes down to physiology. And to test hypotheses about physiology, or to measure physiology and molecular underpinnings. So those are perhaps the directions where we'd like our collaborations to go. So anyway, on this second slide, I just want to give 3 examples of people and in a nutshell the work they've done. There are others. So Claire Williams has looked at the effect of dietary flavonoids on memory, long-term memory in animals and in humans. So she began with a sort of rat model of dementia, where you can get some old rats and put them in a maze like that. No matter how many times you put them in the maze, they never learn to remember the way from start to finish. The young rats do. Supplement old rats with blueberries for a while and they can learn the maze. So she's now taken that into schools and tried it out with primary school age children, and showed they get better at learning lists and things like that and retaining them when you supplement them. So that's quite good. So Carmel, she's got a kind of different focus. She's more into attitudes and behaviour, so trying to get, you know, children to eat stuff, right? To want to eat stuff. I mean, food neophobia is a problem with children. They tend to be very phobic about trying new things. And she's actually shown that, you know, making them put the food in their mouth might be causing fear to some extent. And what you need to do, or what works in her experiments, is exposing them first to the visual appearance of the food, perhaps getting them to smell it and touch it as an initial procedure, and then you get a much better actual eventual outcome in terms of eating it. Now, myself, as I said earlier, I'm a vision scientist by training, really, and I've been looking at supplementation with dietary flavonoids, particularly cocoflavanol and eyesight. Now, you can't both that. This is supposed to be a high contrast image here, but it's actually low contrast because of this is lower contrast. So, what I've found is that, you know, I can improve visual contrast sensitivity through supplementation. So, on the left here, this is kind of like, if that was high contrast, that would be how you see this nice scene when you're a young adult. But I've tested like older adults who perhaps would see this scene more like that because their contrast sensitivity is declining, and shown through my psychophysical tests I can shift them a bit back in this direction through supplementation. And it works for young adults too. I'm now moving on to look at effects on night vision, dark adaptation. And I think, and what I, you know, personally, what I'd be interested in as a collaboration would be anyone who's interested in setting up a European Food Safety Authority health claim related to cocoflavanol and visual function, because they do list in their documents that contrast sensitivity and dark adaptation are both allowable health claims, and I can show effects on these. So that's my project. Thank you.
I head the Biomechanism Engineering group at the University of Nottingham. We're very new at the University of Nottingham. I was previously at the University of Wales Bangor. And we're interested basically in molecular matchmaking. So how do molecules get together, and what sort of impact do they have on one another when they do so? And if we have them together, then can we, for example, deliver them as maybe part of a nutraceutical? So we've focused primarily on phenol-protein interactions. We do have a lot of other capabilities. Primarily because we have a lot of interest in free radical chemistry, so we're very interested in phenolic radicals, so flavonoid radicals, all these sorts of things, and how they interact with the body, antioxidative effects, and also oxidative chemistry within the body as well. But what we've been looking at is then how proteins can interact with these polyphenols, either to modulate the antioxidative activity, so either make them healthier or less healthier in principle, and how they might then act perhaps as a delivery system, because a lot of times these polyphenols can couple together, they drop out. So we have looked at some stuff in relation to tea in particular, with polyphenols that come together forming larger things, and how we can prevent that perhaps with peptides. And more recently we have quite a successful collaboration with Chigask, who are based in Ireland, who have what's known as a Nutrimara project, looking at creating functional foods from from seaweeds, from Irish seaweeds particularly. So they've been isolating small peptides and also different polyphenols, and we've been looking at how we can combine those two things together to formulate functional foods for delivery. So in terms of the sort of techniques that we have available, a lot of kinetic analysis and thermodynamic analysis on a very molecular scale. So we are looking for people who want molecular underpinnings, who want a molecular basis for a lot of things, and are interested in taking that forward, either maybe for with respect to health claims or with respect to novel formulations. We have experience in sort of doing a lot of statistical analysis and looking at large data, and then things like electronic structure and molecular dynamics calculations, so using computers to sort of pre-screen a lot of properties, particularly things like antioxidant properties on the electronic structure front, and then molecular dynamics to have a look at properties of molecules when they come together on a much larger scale. So if any of that interests you, we do have other aspects to our group in terms of waste processing, so we've chatted to a couple of people about that already. Definitely get in touch. My email is on the list. Unfortunately, I've got to disappear off very shortly, so email me. And here's some publications now of our recent work, looking at either protein phenol complexes or a lot to do with sort of antioxidant activity, and those can be found on my academia.edu site. They're free to download if you have any interest in that. So please feel free to have a look at our work, and definitely get in touch, send me an email if you have any ideas with respect to really coupling on the molecular basis and antioxidant work. And that's it.
I think we've all been trying to develop the recipe for health. And obviously I'm not going to say mine is going to do it, or neither is anyone else is probable, but I don't know. I am an academic with a multidisciplinary background. I head food and nutrition at Oxford University. On your tables, I can never travel light, so I brought a bag, and on your tables there's a pack there which gives you some information of the various expertise areas that we have. My main area of research is development of plant temperature indicators, but this is not what I'm here to talk about today. I'm here to talk about something which some of you may be excited about, because those of you who are inquisitive have opened this little bag. Those of you who are not, have not. But if you open it, in it will be something known as kokum. Kokum is Garcinia indica, the botany name. Don't ask me any questions on botany, I'm not a biologist. But it is basically known as mangosteen, and some of you may know it as mangosteen from Africa. Now, in Goa, where I hail from originally in India, it's served as a welcome drink. And also on your tables, some of the tables, there should be a drink that I have bought commercially, which is packed with sugar, unfortunately. But if some of you want to try it, it is safe. I did several colleagues drank it yesterday, including myself, and they've not yet emailed me with any sick notes. So I have been looking at my emails. So if you want to try a little bit, you can. I won't be taking it back in my bag. I'll ask Serena to throw it away. So it is a welcome drink that is available. It has lots of beneficial properties in it. But recently, there has been some papers which suggest there's a component in there which has some weight reduction properties. Now, no one has done much work on it, or at least the last time I looked at the databases, in which they've looked at this active component within this drink, or within any product, including having cocoa in it. We've done a lot of work on the antimicrobial properties of it. Some was funded by a Nuffield project, and that's my student Lucy there doing some HPLC work. She's now doing her PhD at University of East Anglia, so she's not available to carry on with this work, unfortunately. But what we are trying to do is we're trying to incorporate this product into a drink, and what we're looking for is drink manufacturers who help us make this drink. What we want to do is we're going to do a double-blind, randomized study with about 100 subjects that we're going to recruit between 80 and 50 years old. And they will have a Coke and drink once a day, which will be monitored for 6 months. So this is a proof of concept project. We're not going to look at standardizing for the active component or anything. All we want to know is it going to reduce weight or not. They're not going to change their diet. The diet is going to be the same. I have had long discussions with my nutritional colleague yesterday afternoon, and I was grilled by lots of people who we have just recently recruited someone who's done a lot of work on nutritional claims. So first I was grilled by her, then I was grilled by my nutritional colleague, and we came up with something that we want to do simple, and we want to know a yes/no answer. Based on that, we may do some following work. I've looked at the various funding schemes available on the KTN website, and I think we would seek funding on the Drink 2 scheme under the Designing Foods to Maintain and Improve Health scheme, or perhaps the KTP scheme. We're not sure. I've had some discussions with Appetito already, and they're just down the road from me, and I've never had the time to speak to them, so it's been awkward. Now, when Stephen Hawking started his PhD, he was told he needed 3 things to carry on in science. Once, he needed brains. Next, he needed the balls, and then he needed the cash. I hope I have the brains. I certainly have the balls. Now all I need is the cash.
Good afternoon. In the last 5 years, I've moved from aquaculture into agriculture, and primarily into the poultry industry in the growing of broiler chickens. This graph here, I didn't have room to put the previous 20 years on here, but each one of these green and blue columns represents the 2 houses on the farm that I started with. The growth rate was consistently for 20 years less in house 2, blue column, than it was in house 1, green column. The red line here delineates the 21st of June last year when we put our first system into this farm. Since then we've got several other farms and repeating this process. And you can see immediately the increased growth rate. Now this has come from transposing the science we were using in aquaculture, which was redox manipulation of the water, to enable us to transport low volumes of water with high density of fish, ornamental fish, very valuable. We didn't want them to arrive dead. So we then transposed that science from aquaculture in the aqueous form into the gaseous form, and we got some rather interesting results. Now, we can't definitely prove that we've had improved health, but we can say we've had no veterinary visits to any of our treated houses. But we have had increased bird weight, and this translates into cash for the farmers at the end of their 7-week crop, and that's what they're most interested in. The idea is to breed these animals without the need of antibiotics, which is what we managed to successfully do in the aquaculture world, and we made quite a bit of a difference to the profitability of that side of the market. The other
benefits, of course, are a reduction in odour from these poultry farms. We found that our gaseous form of treatment actually reduces hydrogen sulfide, which is a chemical which can promote the production of ammonia within the bird's gastrointestinal system. And this has resulted in probably 60 to 70% reduction in the offensive olfactory offensive gases coming from the poultry sheds, which is good for the environment, I believe. So we're now looking at taking this a step further. Instead of concentrating solely on broiler growing, we're now looking at the breeding side. Presently, they use some pretty hazardous chemicals to sterilise the actual live fertile eggs in storage, from the layer house to the storage room, then to the hatcheries. We're looking at replacing that with our relatively benign gaseous treatment and have exactly the same kill rate as what they use at the moment. Also, another science that we're looking at now is to treat grain storage, the food stuff for the chickens, to avoid mycotoxins and to replace, again, the hazardous chemicals, which I've learned to my surprise, they actually do put into the poultry food to sterilise the food. But we think we've got a better system. We've certainly proven it in the aquaculture world, in the gaseous applications I already described. And there we go. That's all I have to say.
How we project that far. First, why soya? Soya is the highest source of protein in all vegetables. Soybeans contain more protein than any other vegetable source. The protein in the soya has got an amino acid profile that is nearer to meat than any other vegetable source. So soya should be the choice for vegetarians for both the content of protein and for the amino acids present. So that's the primary school introduction to soya. What do we know about soya in the food chain? Soya tends to go like this. You start off with a soybean, you crush all the oil out of it, that goes off to the oil processing industries, and what's left, some very clever people have turned it into ingredients that we recognise as soy protein isolates, soy flours and things like that, which are used in the food chain. So you extract the oil, you can take the lecithin out and use that as an emulsifier. What you can do in the health food side of the business is you can make soy milk and you can make tofu. Before you make those, you crack the shell off and throw the shell away. So the current use of soybeans is going down the nutritional chain. Let's have a look at sprouting. Most people in the room will have had the benefit of sprouting in at least two ways. Bean sprouts in Chinese and Oriental type food, malt in beer. Sprouting, you have to think, excuse me if I just give a primer. You start off with a soya bean, as you start off with any bean, and a bean or a seed is a plant waiting to happen. There's a little warehouse, and all the building materials that will turn into a new plant are sitting there in an insoluble form so that they can wait till the right moment. When the right moment comes along, the right moisture, the right temperature, enzymes activate, and all the proteins that are in the bean, or the carbohydrates that are in the bean, get broken down into very simple sugars and very simple amino acids. And the bean looks like that. Once the bean starts sprouting into what we know as bean sprouts and things like that, all the amino acids have been put back together into proteins, into complex forms. All the sugars have been put back together into strong carbohydrates, so you're starting to rebuild them. But at this point in sprouting, you get very high nutritional benefit. I haven't even mentioned yasso yet, but this is where it gets introduced. Yasso is an innovation in soya. We take soybeans and we sprout them to that point there. We've worked with the University of Budapest to give this patented process which controls this as being the highest, the point where the sugars and the amino acids are at the highest available level. So soy is the most complete vegetable protein source. Because this natural business of growth, beans are being just like us, they need energy to grow. A lot of the sugars that are in there are getting broken down into water and carbohydrate and completely disappear. So when you look at a sprouted soya bean, the way we do it, the carbohydrate's been reduced from about 10% to about 4%. That compares to something like a chickpea, which would be about 25%. The protein to carb ratio increases from about 1.4 of protein to 1 of carbohydrate to 3.5 of protein to 1 of carbohydrate. The fibres increase from 6 to 8.8%. The indigestible saccharides are metabolized to digestible sugars. What does that mean? It means you don't get winged. The indigestible sugars in these beans go through to your large intestine and then they produce gas. Those indigestible sugars have been broken down by this period of sprouting and are not present in our beans. Anti-nutritionals, the trypsin inhibitors and unwelcome flavour elements that give soya powders and things a typical flavour which is unpleasant and which is beany, which you have to mask before you even start using your soy protein isolates and whatever, are completely absent from Yasso. And the omega-3 content has increased from 6% of the fat to 9% of the fat. This product is offered chilled with a 5-month shelf life in a whole bean form or in a paste form. And just in the last month we've started working on IQF, that's individually quick frozen. That means instead of getting one big lump of frozen stuff, you get it just like your peas or your sweet corn at home. It flows out of the box ready to use.
Good afternoon, my name is Yan. I'm from Touch App. We are a mobile and web development company working especially for the life science sectors. We have a very experienced development team and already published a series of very popular life science products. Here are some examples of our products. Because most founders of our company are from the life science background, so we see the new digital technology actually can help and improve many aspects of the life science sectors. For example, you can using the mobile technology to develop software and mobile tools to help the research process. And you can also change the way of teaching and learning. So we provide a service to collaborate with institute and business to create bespoke e-learning and mobile learning products. And it also possible for the anytime, anywhere mobile products to help improve the healthcare service. It potentially can benefit both the doctors and the patients. And it also can revitalize the industry. So it's much easier for your customer to give real-time feedback through their mobile devices and create new business models. For example, you can sell your products directly through mobile app and promote through mobile app. Here is an example of the collaboration we have already started with the University of Nottingham. Smart Nutrition, it's an interactive, personalized nutritional platform, and using the mobile interactive technology, so people just play the mobile games. Your eating habits can be analyzed by the mobile software and will give informatic suggestions how you can improve your diet. And we are also going to provide models for specific medical conditions such as diabetes, pregnancy, or vegetarians to help all kinds of people to get optimum nutrition for their life. So we are open to all kinds of collaborations. So if you want to bring your business to the mobile or web platform, do contact me. Thank you for your time.
Yeah, I'm Ian Cox. I work at Ferrer in York. For those of you know, have been there with big white buildings sort of on the way out of York heading towards Scarborough on the A64. Ferrer, it's the Food and Environment Research Agency. We're an executive agency of DEFRA, which allows us a bit of licence to do some work with industry. We don't just have to do government research. We provide a lot of translational science solutions to people, so we solve real life problems that people have both in industry and government as well. That's our facility over there on the right hand side at York, the big white building. We can do everything from sort of desk studies right through to sort of semi-field scale trials on site there. We have good relationships with local farmers as well, if people want to grow new crops or anything like that. Services we can provide, we do a lot of analytical chemistry and biochemistry on site there. We have a large team of those guys. We also have an increasingly larger molecular biology team now, which are very much into next generation sequencing, so we can look at doing targeted DNA analysis of what's actually out there in the big wide world. We can bring all this together with bioinformatics capability on site, so we can actually make sense of all the data. We can do a lot of work on modelling. We've developed things like QSAR models, quantitative structural analytical relationship models, in the past, so we can help with sort of all the sort of structural relationships of chemicals out there. We can look at risk analysis, and increasingly we're starting to move down the road of omics, sort of starting to bring together sort of targeted and untargeted chemistry with the microbiological side of things together into one big thing. We're also a national reference laboratory for food and food contaminants out there, so we can check for things like mycotoxins, PCBs, anything, heavy metals in food, that sort of stuff. And over the last year or so, we've been quite successful on TSB calls. We've won over £1 million worth of additional funding for ourselves through these calls. So for our partners, it's well in excess of £1 million there that we've brought in. I'll just give you a flavour of what we get up to out there. Food integrity, very much part of this call here. We've got a couple of projects, big ones out there. Authentic is a TSB project we've got going at the moment, which is looking at everything from authenticity of whiskey right through to a whole variety of other stuff. And then Trace was a big EU project we had, which was looking at everything from beers to wines and honey. So you'll spot there's a bit of a, we quite like our alcohol there, amongst other things. We also do a lot of work looking at processing contaminants as well, so we can tell you what you like to find in the sort of production line. And also, we're also very good, we think, at looking for identifying potential contaminants, something that might occur out there in a production situation. Other areas we're interested in as well, we've done a lot of work looking at things like nanoparticles. Increasingly, everything seems to be going nano in the world, so we've actually done some work on risk analysis side, looking at the effects of, say, titanium dioxide in icing sugar there. People are using it in all sorts of things, everything from putting nano silver in your socks to stop them smell, right through to everything out there. Sort of several thousand applications of nanoparticles, but nobody really knows what they do in the big wide world when they're out there and what effect they have, and do they get back into the food chain. So we're doing quite a lot of work on that. Another area down here, metamicrobiology. This is relatively new, advanced. Everybody has fingerprints, or so does a lot of food and animals out there. So we're starting to look at what the microbial fingerprint are of animals. Melton Mowbray, we're doing some work on Stilton cheese. We're actually trying to work out what the metagenome of Stilton cheese looks like, so we can try to do an authenticate cheese to make sure it does come from the Melton Mowbray area. So it's about proving the authenticity side of it. So we can do everything from prawns in sea, what else? Shellfish. We can look at organic versus conventional production methods. We can sort of say whether it's that or the other. And lastly, a couple of examples here of projects that we've got ongoing at the moment. The one on the right, AMHA, we work with the Manuka Honey Association, and we've done some work looking at the activity of Manuka honey and working out what the active ingredient is that gives it its antimicrobial properties. And Abstress is a large EU project we've got going at the moment, where we're looking at sort of plant breeding and genetic diagnostic tools and that to improve the breeding of peas. There's a lot of work going on since Gregor Mendel doing all these tests in the past, where we're now trying to breed back in some good traits into peas to reduce drought tolerance or drought tolerance and
sort of in disease resistance as well. So that just gives you a bit of an idea of what we get up to. We are very much interested in any sort of industrial partner or anybody that wants to work with us on future TSB calls. So thank you very much.